Dr. Naved will be presenting on visual assessment of UP State Road Transport Corporation bus drivers during Road Safety Week 2024.
So my topic is visual assessment of UP State Road Transport Corporation bus driver during the Road Safety Week. Road Safety Week is a paramount. The visual health of the driver is crucial factor in preventing the accident and ensuring the well-being of both drivers and passengers. So the UP State has undertaken a comprehensive initiative to assess the visual acuity and color vision of its bus driver during the Road Safety Week. So the aim of my study to assess the visual acuity and color vision of the bus driver and to conduct the comprehensive vision test to determine the visual acuity and color vision of the bus driver and identify the common eye conditions such as cataract, refractive error, and other conditions like color blindness, and to promote the awareness among the bus driver about the importance of regular eye checkup for Road Safety Week, and recommend and implement the necessary intervention including the corrective eye wear and medical treatment for drivers with visual impairment. This is a cross-sectional study conducted between the 11th January to 17th January during the Road Safety Week on total 143 drivers at Sohrab Gate and Vaisali bus stand Meerut, and the comprehensive eye examination and visual assessment using the standard visual acuity chart and Ishihara chart. So all drivers employed in the UP State Road Transport Corporation who are willing to provide informed consent to participate in the study are included, and the drivers with previous eye surgery and ongoing eye treatment which interfere with study result were excluded. Individuals with medical condition that could affect their vision temporarily also excluded. So the maximum number of the driver belong to the age group of 31 to 40 years, followed by 21 to 30 year, and 41 to 50, and 51 to 60. So maximum number of driver poses the visual acuity 6/6 to 6/12, followed by 6/18 to 6/24. And the maximum number 142 driver had the normal color vision, and one driver was partially colorblind. The majority number of drivers have excellent or near normal visual acuity 6/6 to 6/12, and a small percentage showed decreased visual acuity which could affect the driving safety. And color vision impairment is rare, affecting only 0.7% of the driver. So the largest age group is 31 to 40 year, followed by 21 to 30 year, indicating the bulk of driver are relatively young. And the 92.7% of the bus driver meet the visual standard that indicate the current government policies are effective, that ensure the necessary visual capability for safe driving and contribute to overall public transportation safety. The visual acuity is a crucial factor in driving. Clear vision is essential for identifying the hazards to ensure the quick response to traffic signals and signs. 99.3% of the drivers have normal color vision, which reduce the risk of accident due to the color misinterpretation. There is always a room for continuous improvement, so we implement more robust visual health programs and enhance the driver education on eye care and regular visual assessment for early detection of issues. 7.3% of drivers do not meet the visual standard, and 0.7% are partially colorblind, who are concerned for public safety, require ongoing visual assessment, and require interventions and resources like corrective eye wear and medical evaluation and alternative duty without driving. Thank you.
Doctor, you have taken these patients only the visual acuity and color vision.
Yes.
What about the field of vision, only the confrontation?
So
is it not important?
Yes, I'm important.
So we should check also. Yes. What about the fundus examination? Because number was not so much. At least you should see the disc for any evidence of glaucoma or the macula. And then you should assess the systemic disease also, whether a patient is diabetic or hypertensive, because these drivers are always in tension.
Yes, ma'am.
Stress. So they may have the hypertension also.
Yeah.
So this will not be sufficient. You can add these things also.
Okay, thank you, ma'am. चलता नहीं नहीं सर, ये 3 मंथली 4 मंथली 6 मंथली ये चलता रहता है सर जी।
एंड डॉक्टर साहब जो कह रही है वो कंसल्टेशन वाला फील्ड भी बहुत जरूरी
जी
है, बिकॉज आई नो द ड्राइवर्स हु कुड नॉट रियली सी ऑन साइट्स इन यूपी ओनली बिकॉज ही हैड डिप्लोमा बट विजन वाज 6 9.
ओके सर, थैंक यू सर।
For the person who was color vision defective, did you do anything? Did
Yes,
you
sir.
report that because he will
Yes,
be
sir.
a hazard?
उसको सर
government?
मैम उसको ड्राइविंग से शिफ्ट करके डेस्क जॉब पे लगा दिया गया है, और एक ही ड्राइवर मिला था हमको, तो उसको हमने ड्राइविंग से हटवा के उसको डेस्क जॉब दिलवा दी थी।
Thank
For
you.
your general knowledge to everyone, color vision is not considered anything in the European countries for drivers. Because all drivers can see the red and green signals with a lantern chart. We do only ishara. Ishara chart, so many people will fail. In fact, partially blind, you know that partially colorblind 4% males and 5-3% in females. So at least यूरोप में तो अभी मैंने भी इस देश में करा दिया है कि विजन के लिए, उसकी ड्राइविंग के लिए कलर विजन इज नॉट ए, इफ दे हैव गॉट द लेंटन वाला टेस्ट पे बड़े लाल देख लेते हैं, बड़ा रेड देख लेते हैं, फिट. सो ड्राइविंग एंड आई टोल्ड यू दैट यूरोप में ड्राइविंग के लिए कोई कलर विजन नहीं करता.
Lantern test is not available usually at all the centers.
हाँ यस।
And the